So we're going to lose one of our testicles.
People who stop at nothing to spend nothing? What? That sounds extreme. Today, we are reacting to the possible medical injuries and health situations of the reality TV show Extreme Cheapskates. Let's dive right in.
The past 6 years, Mark has volunteered in more than 100 medical studies, and the riskier the trial, the better it pays.
He likes doing medical studies. It can be ranging from anything, vaccines, medications, topical ointments. It ranges from probably a couple bucks to maybe hundreds and thousands of dollars. Modern medicine cannot move forward unless we have volunteers for these different types of studies.
When I was doing clinical trials, I would get these scrubs. I would take a pair home. I would use them for daily work, exercise, and for doing other clinical trials. Saved on laundry, cheap to clean, and they were free.
I take some scrubs home with me every now and then. If you see on the scrub pants, there's barcodes on them. The hospitals have to keep track of their clothing. Typically, those scrubs that we wear at the hospital, we actually take off, not actually taking home grossness, nastiness that you get from the hospital.
The two studies that I'm waiting on that I have not been in yet is a flatline study. This is a really good one. What they do is they stop your heart for 1 minute, but you still breathe. Stay there 14 days, pays $25,000. But the FDA kind of stepped in and stopped that.
What? I use a medication in the emergency department during emergency situations where I have to stop somebody's heart to restart it, but it lasts like 2 to 3 seconds. I don't know exactly what he's talking about.
The second one that I'm really anxious and really excited and waiting to do is this testicular study. What you do is you go in and you donate one of your testicles, they replace it with an artificial one, and when you check out after 14 days, you get a check for $35,000.
Stop it. My testicle is worth a lot more than $35,000. They're replacing it with a nudicle, which is a fake testicle.
Mark participates in so many clinical trials that he gets free checkups every month.
If you are a healthy individual, you should probably go to the doctor maybe once or twice a year. But if you have any type of medical issues, diabetes, anything cardiac, you probably should be getting checked up every 3 months or so. And then maybe once things stabilize, the doctor might spread it out a little bit further.
So what's motivating you to want to go under the knife and be part of a study like that?
Good question, Dr. Goldsmith. It's a question I would ask if I saw a patient as well.
The money.
So let's think about what you just said. So we're going to lose one of our testicles.
His face is so shocked. He's just like, I can't believe I'm having this conversation with this guy.
So what I'd like for you to do is take off your shirt.
Okay.
And I'll come back in and we'll do a brief exam.
Okay.
Okay, and also, I gotta check out your gyms.
Okay.
So we'll take a look at that too.
Okay.
Maybe he doesn't need his testicles anymore. Maybe he has all the kids in the world he wants. With one testicle, you can still have a normal functioning life. Modern medicine cannot move forward unless we have volunteers for these different types of studies.
Being a lab rat, you have to be very healthy. Your labs have to be in certain ranges and levels, in a healthy level, to be a healthy control.
Study designs are very complex. People do different things in their lifestyle that you can't control for. A lot of times when it comes to just medicine, it's like, we're just gonna give this side the med, this side the placebo without them knowing, and then we'll just check on them in whatever time intervals that they have for their study design.
I believe I was having the placebo effect.
Karen Hearn finds extreme savings on medicine and medical supplies for her family. Since a typical doctor's appointment can cost between $150 and $500, she even does her own medical procedures at home.
Oh my God, don't do that. The fact that she's just hoarding medical supplies at her own house. Important medical supplies that you should have at your house: Band-Aids, triple antibiotic ointments, maybe some Vaseline, maybe some tweezers, tape is good, and then the simple medications like ibuprofen and Tylenol.
But for larger, more serious problems, even Karen will succumb to the occasional visit to the doctor's office.
You definitely have an abscess on that tooth. What I recommend you do is do a root canal on this tooth.
A dentist actually won't do anything, typically, you correct me if I'm wrong out there, dentist, until the patient's been on a course of antibiotics, because if they start messing with it too much, that infection can actually seed further.
Would it be cheaper if I went without any anesthesia?
That's not a good idea.
Can I think on it?
A root canal is basically when the roots of your tooth, they actually go in and basically clean them out and then actually clean out the nerves. There's drilling going on, cleaning going on. Yeah, you want to be numbed.
Karen Hearn and her husband have performed various medical procedures at their home before, But now, for the first
Stop
time,
it.
they're attempting a tooth extraction with the aid of some online videos.
The extraction will actually take place
Oh.
using this barber's tool.
No! Rusted barber tool that's not sterilized. So the tools that a dentist uses, they're sterilized, they're clean, they're free from infection. Oh, my face is hurting just thinking about this.
I'm building a vacuum for our mouth. I'm using a regular vacuum cleaner. And I'm going to stick out a part of the mouth and we can suck out the blood. I'm ready as I will ever be.
Oh my gosh! Do not use your Dyson to suck out stuff in your mouth. That is so disgusting. Is it a closed unit that's not gonna re-aerosolize? Stuff is being sucked out and putting in the germs in the air? Think about that.
Karen's dentist would have charged $185 for the tooth extraction. But because she already had most of the supplies on hand, the procedure will only cost $10.
Oh my God. She is trusting her husband, who is not trained, to do this procedure. I wouldn't even do this procedure, and I'm at least a trained medical professional. This is crazy. No way. No way.
Pain only lasts a short time.
But saving that money lasts so much longer.
That is insane. You're not just having a specialist there to pull the tooth out. You're having the specialist there, pulling the tooth out, and then if something goes wrong, they can fix the problem. This could be life-threatening.
Some people see dumpster diving as like a sport.
I want to know who thinks dumpster diving is a sport.
I don't see it that way. I just see it as something I have to do in order to get what I want for the price that I'm willing to pay, which is nothing.
Yes, I understand. Sometimes people throw things out that have a lot of value to somebody else. But dumpsters, garbage, they harbor germs, disease. There's things that are sharp in there. You can cut yourself. Just be careful and know what you're picking through.
The main things that I look for when I go dumpster diving now are medications, especially prenatal vitamins.
What?
I research all medications before I take them, and I've been doing this a very long time. Don't try this at home.
By foraging through dumpsters behind pharmacies and hospitals,
There's a reason why they're throwing out the meds. Either they're contaminated, they're past their expiration.
25-year-old Angel Durr has managed to save more than $350 on vitamins and medications over the course of her 8-month pregnancy.
Ah, so she is pregnant, okay. Is it worth the risk of your health and the health of your unborn child? If you ask your local resources in your town, I guarantee you there are either programs or places that you can get medications for super cheap or even nothing.
A lot of times they put expiration dates on things way earlier than they need to just to sell more products.
No, I would disagree with that. They've done studies on these things. Probably there is a chance that the medication is still fine and is okay, but they can't guarantee it, and that's why there is an expiration date.
Bingo! It's folic acid, which is good for pregnancy.
Folic acid is good for pregnancy. Folic acid, major job is to prevent spina bifida.
There's no need for me to use the washing machine because it just costs too much money. I could just reuse the water right here. There's a lot of wear and tear on your clothes in the washing machine. I'm able to wash my clothes in here. My clothes last for years.
Okay, hot tub, jacuzzi water typically has chlorine in it. So then the question is, how much chlorine is actually in that? It's probably fine. And then how often are you changing out that water?
I just put a little bit of soup in my plastic container, and you'd be surprised at how quickly it heats up.
But you're heating the hot tub up. That's not inexpensive. Yeah, this doesn't make sense.
Because my hot tub's not going to add any value to the house, I decided to use it for multi-purposes. It costs about $15 a month to take a 10-minute shower every day, and that adds up.
You're doing everything in a cesspool of water that can be filled with germs, and you're not cleaning it that often. When you have your buddies come over, you're like, no, that's the washing machine for the day. We can't go in it.
This hot tub, I mean, this thing is a money saver. I mean, this is like a cash cow for me.
Cash cow? It's the trough that the cow is eating out of. I would advise against this. There's a reason why we have all these other appliances in our homes to stay as clean as possible and keep things separate. These are crazy. I need to see more individuals that are trying to save money and what it actually can do to their health. If you guys enjoyed this, definitely check out this series right here. Binge watch the whole thing. And as always, do me a favor, subscribe, turn your bell notifications on, hit that like button. And thank you so much for watching. Stay healthy, my friends.